Hi, I'm Charlotte Moser, the co-director of the Vaccine Education Center at Children's Hospital of Philadelphia. And today on VEC Vaccine Notes, we're going to be talking about Cytomegalovirus, or CMV as it's more commonly known. In the 1980s, pregnant healthcare workers were not allowed to care for infants who were affected with CMV. The risk to their own unborn infants was considered to be too great. You see, CMV causes a condition called congenital CMV, in which infants infected during pregnancy can be harmed. They can be born with birth defects or have lifelong conditions. Today, CMV is considered to be the most common infectious cause of birth defects in babies both here in the United States as well as around the world. In the United States, about 1 of every 200 babies are born with congenital CMV. And about 1 of every 5 of those affected babies will have birth defects or experience long-term health conditions. Yet today, in 2026, pregnant healthcare workers are not restricted from caring for infants born with CMV. Why? Because studies found that the virus responsible for congenital CMV is so common that a pregnant healthcare worker's risk of exposure is no greater at work than it is if they're in their community. During the next little bit, we're going to talk about the disease caused by cytomegalovirus, including congenital CMV. Currently, there are no vaccines to protect against this infection, but we'll talk about what the goals of a vaccine would be and where things stand with vaccine development. We'll also discuss a few questions we've received here at the Vaccine Education Center. And while we can finish up with a discussion of the risks of CMV, we won't be able to compare those to a vaccine, since currently vaccination is not an option. So let's get to it. Cytomegalovirus, or CMV, is a virus that infects only people. It's a member of the herpes virus family, and like its relatives, herpes simplex virus and chickenpox, this virus stays in a person's body after they were infected. As a result, it can reactivate at other times throughout life, such as when a person's immune system is compromised. During pregnancy, the changing hormone levels that a woman experiences can cause reactivation. However, the greatest risk for an infant is if the woman is infected with CMV for the first time during pregnancy. CMV is spread through direct contact with body fluids, including urine, saliva, blood, tears, semen, and breast milk. The virus can also spread in transplanted organs or during blood transfusions. During pregnancy, CMV can infect the placenta and spread to the developing baby. Now, studies have demonstrated that most people have been exposed to CMV. In developed countries, studies suggest about 4 to 8 of every 10 people have been infected. And in developing countries, as well as in certain groups within developed countries, that number increases to about 10 of every 10 people in some cases. What's important to realize, however, is that young children are likely to be infected in group childcare settings, and this means a few things. First, even if the child doesn't have symptoms, they can still spread this virus. In particular, CMV can stay in a child's saliva and urine for up to 2 years after their initial infection. And during that time, they can spread the virus. Pregnant mothers and other people who spend a lot of time around these young children are more likely to be exposed to the virus. Studies suggest that about 1 of every 3 children are infected by the time they're 5 years of age. Most of the time, CMV does not cause serious health issues for people who are infected. They might experience some symptoms like fever, tiredness, sore throat, or swollen glands. In rare cases, people can experience mono-like symptoms, including a prolonged fever or inflammation of the liver, which is called hepatitis. Now, some groups of people are at increased risk for complications from CMV, and those include babies that are born early or with a low birth weight, people that have weakened immune systems, such as those with chronic conditions like HIV, or those who are pregnant, and those taking medications that weaken their immune system. When people experience complications of CMV, they can experience shortness of breath or cough, blurry vision or loss of vision, severe stomach pain, including bloody stools, nausea, vomiting, or diarrhea, or they can experience inflammation of the brain and spinal cord, which is called encephalitis. Now, while pregnant people are at increased risk for severe CMV, they don't always have symptoms or even know that they've been infected. Instead, the risk comes from the effects on their developing baby, which, as we've discussed, can result in congenital CMV. Affected infants can experience things like a rash, hearing loss, yellowing of their skin or the whites of their eyes, called jaundice. They can be born with a small head, which is called microcephaly, or they can have an enlarged liver or spleen. They can experience seizures, or they can have damage to the retinas in their eyes. As a result of severe symptoms or complications, infants affected by congenital CMV can also experience hearing loss, cerebral palsy, developmental delays, vision loss, seizures, or even death. As you might be realizing, the biggest concern when it comes to CMV infections are the effects it can have on babies that are infected before they're born. So let's switch gears and talk about the situation with vaccines. As mentioned, there are no CMV vaccines available anywhere to use in the United States or elsewhere in the world. There have been two groups that have been the main focus of vaccine development. First, it's those women who may become pregnant but don't have evidence of a prior CMV infection. And second, high-risk groups, such as transplant patients. Most of the focus has been on protecting women before pregnancy, and the goal here would be to use a strategy similar to what we do with rubella, or German measles, where the main reason that we vaccinate a girl is so that they have immunity to rubella before they would become pregnant. As with CMV, rubella infections during pregnancy are extremely risky for the developing baby, so that's why we want to make sure that doesn't happen. Unfortunately, despite years of work toward a CMV vaccine, none have worked well enough to be licensed. There was a candidate vaccine that reached phase 3 trials and seemed very promising. It was using mRNA technology. Unfortunately, those phase 3 clinical trials were stopped in 2025 because the early data from the trial suggested that the vaccine was not appreciably decreasing the risk of infection during pregnancy. Several other candidate vaccines are still in clinical trials, but these are currently in earlier stages of development than the mRNA vaccine was, or they're being evaluated in groups other than women who may become pregnant. Like I said before, one example would be for transplant patients. Now, because there's not a vaccine for CMV, we don't get a lot of questions, but there are a couple of questions that are worth our consideration today. First, some pregnant women wonder how they can protect themselves and their unborn babies from CMV since there is no vaccine and the infection is relatively common. Pregnant women can lower their chance of getting CMV and passing it to their babies by reducing their contact with saliva and urine from babies and young children. This means not sharing food or utensils or straws or cups with a child, also washing hands well after changing a diaper or helping a young child to use the toilet. Another question we get is which other groups are at increased risk from CMV infections, particularly since this virus is so common. This question requires us to consider two different aspects of CMV infections. First, there are people who've not been infected at all and are at increased risk if they get their first infection. And second, since this virus lives in our bodies after we're infected, it can reactivate and cause concerns if someone's immune system weakens, for example. With these things in mind, some of the groups at increased risk include transplant patients and those with HIV. Likewise, the virus has been implicated in some other situations. For example, in the development of some cancers, during aging of the immune system, which is called immunosenescence, and for the progression of diseases such as heart disease and tuberculosis. And negative outcomes following severe illness that require intensive care has been another place where CMV may play a role. Now, one other note about people who have a history of previous CMV infection is that there's some evidence that suggests they may have lower immune responses to some routine vaccinations like influenza and COVID-19. So let's finish up with a brief consideration of the risks of CMV. As we discussed, we can't compare with vaccination because no CMV vaccines have been licensed at this point. When we're thinking about CMV infections, we know they're common, with about 4 or more of every 10 people in different populations having evidence of previous infections. For most people, they have mild symptoms, but some will experience more severe symptoms or complications. The greatest risks are for infants, pregnant people, and those with weakened immune systems. Congenital CMV, which occurs when a developing infant is infected before birth, is the most common infectious cause of birth defects in the United States and around the world. In the U.S., the rate is about 1 of every 200 babies who are considered to be born with congenital CMV. And of those affected babies, about 1 of every 5 will experience birth defects or long-term health outcomes like hearing or vision loss, small head, seizures, developmental or motor delays, and sadly, in some cases, death. Children and adults who experience complications can have shortness of breath, blurry vision or even loss of vision, severe stomach pain and related digestive complications, or inflammation of the brain and spinal cord. Unfortunately, at this time, we can only work to decrease the chance of at-risk people being exposed to this common infection, as we have no way to protect ourselves against it with vaccination. Thanks for listening today.